Good morning, my name is Francis from the Health Retreat in beautiful Reeseville in Queensland, Australia. And we run the most effective retreat for depression, anxiety and self-medication in the country. Many people have tried everything. They go to rehabs and within 10 minutes to a day they're back drinking, taking drugs and doing all the things that they were doing before. We are the most effective because everything we do is common sense. I call it uncommon sense because it's not very common. What a normal therapist does is they get you to work through the issues. And some people go to therapists, the same therapist for 10, 15, 20 years. They're given prescription medication for 10, 15, 20 years with little or no change to their condition. We believe that by going over and over and over the issues, all you're doing is making things worse. I know I suffered from post-traumatic stress, depression and anxiety with self-medication after a fatal car accident. You can't get clean while you roll in the mud. This is where our point of difference is to everyone else in the country and possibly the world. We get you to let go of the triggers. Now, doesn't that make sense? Let go of the triggers that make you feel the way you do. Then we rebuild your self-worth so you start to feel good about yourself again. Then we consolidate that change. How do we do that? It's quite simple. We have the 4 best inner journey therapists in the country, one of which possibly could be the best in the world. We then have our group therapy. Now, the group therapy isn't a group of people sitting around in the circle saying, look, I'm a junkie, I'm an alcoholic. If you tell yourself you're a junkie or an alcoholic enough, that's what you'll become. You'll be exactly what you call yourself. Our group sessions are about consolidating the changes that we've made to your neural pathways. Again, common sense, isn't it? Make the change, feel good about yourself, and then consolidate the change. But what about when I go home? What happens when I get back to that very same environment? Well, we prepare you for that with groundbreaking real-life therapies, real situations which relate directly to you. It's so important that you get the tools to prepare for when you get home. And then we have also absolutely groundbreaking aftercare, so that you're supported every step of the way. Because we know you're going to be vulnerable the first month, 2 months, 3 months when you get home, and we're there for you. Many of my clients ring me up at 2 o'clock in the morning and I take the call. Now people say, why would you do that? Because that is a defining moment in their recovery, isn't it? If they know that they can ring me and get the help that they need until we can get a therapist who they've worked with while they were with us to help them get back to where they need to be. It may only be 1 or 2 humps that we need to get them over until it's become normal. And that's a strange thing to say, become normal. Before they came to us at the health retreat, depression, anxiety, and all of the associated conditions like insomnia, like eating disorders, and like self-medication had become normal. Not to the loved ones around them, because we just couldn't understand why they were doing it, but to them it became a normal way of living their life. After they've been with us at the health retreat, they have a new normal. Isn't that exciting? A new way of dealing with things. We also encourage the family while they're with us to come and visit, to do part of the program, and there's no charge for that. You have to find your own airfares if you live somewhere else in the country. But then you get a handle on why they did what they did and what support they're going to need when they get home. Again, it's common sense. A common sense approach to mental health. What if I'm on drugs now? What if I'm on prescription drugs, which I believe is a bigger problem than illegal drugs? You take your drugs when you come to us, your prescription medication. And then when you're ready, funny thing to say, then when you're ready. We can't take away your coping mechanism until we replace it with a new coping mechanism, which is your brain. Make sense? Otherwise you'll just crash and burn. Some drugs need doctor care because they're so severe what they've done to your body. So you'll have regular visits to the doctor to make sure we don't have seizures and all the other associated things. I've had people come to this retreat that have been on Xanax for 20 years. I've had people that have had in excess of 20 ECTs. And if you don't know what ECTs are, electric shock treatment, okay? They've come to us and we've had a positive result. We've had people that are drinking copious amounts of alcohol. We've had people that are addicted to ice, heroin, cocaine, etc., etc. We've had a positive result with those people. And I had a young girl who now works for me who came to me with prescription medications big enough to fill a bag of a loaf of bread. I personally took her to the doctor every day for the first 7 days because I was scared of losing her. She's now got through to the other side and now she does consultancy work with us. You owe it to yourself. You owe it to your family. This is a very, very serious problem you're now facing. And for the very serious problem, you need the very, very best of help. We have over 135 years combined, not with one person, or they'd be 200 years old, combined experience, okay? We are skilled in every modality that you're going to need to reach the other side of this serious challenge in your life. All I'm going to ask you to do is pick up the phone and ring me. If you don't feel comfortable doing that, send through the email from the website that you're probably now on. Get the help you need today. Some people say, look, it's expensive. And I say, how much would you be spending on illegal drugs or drugs over the next 5 or 10 years? What damage is it going to do to your workplace and your family life? This is the best money you're ever going to spend. Don't waste it on what you've been doing for the last 1, 2, 5, 10 years. Use it to get the help you need. I look forward to meeting you at the health retreat. They really say that my jokes are the reason everyone gets better. I think they're joking with me when they're saying that. But come and see us and get the help you need. Have a great day. Ciao.